What we're going to do, guys, now is going to ask the panelists some questions, and we're going to take tonight to a whole new level. So, Caroline, you're up first.
I guessed.
Are you ready?
I am, I think.
All right.
Is it on? Can you hear me? Yeah.
Actually, can we get that turned up just to thank you, Carolina? All right.
Such a quiet little thing.
Caroline, how do you see the concept of the village outworking through SafeWatch and the potential value of it?
The potential value to describe the value is quite difficult because it's actually very profound, and it's something that a therapist and a client really understand the depth of the importance of something like the village within SafeWatch. I know that my client, if he has a sudden downturn, that he can reach out to somebody who's really important. His scaffold is secure, and that's his village. It's actually really lovely to know, because ordinarily I'd get the phone call,
Fantastic.
and not a pleasant one necessarily.
Yeah. And Caroline, tell me, what value could SafeWatch add for people who have a gap in therapy or even a change in therapists?
Yeah, I often get people who've had a stream of therapists, and over the years, with SafeWatch, a psychotherapist is different to, say, a clinical psychologist and a psychiatrist and a counsellor, in that I'm not trained in doing formal assessments. My expertise, I suppose, is in studying in more depth a multitude of modalities. I've forgotten the question now.
What value could SafeWatch add for people who have a gap in therapy
yes, sorry.
or who see several therapists?
Yeah, I remember now. So with that, if Sharon has done an assessment on a client who has subsequently come over to me, I can see on SafeWatch that Sharon has carried out that assessment. Mm-hmm. And I'm very familiar with all the typical assessments done, so I know the categories. So I can really hone in on something such as anxiety, scoring very low for the client. I can see that, and we can focus on that, because sometimes you do get clients coming in the door and they just don't know where to start. They don't know what is the issue, and to really kind of hone in on that. SafeWatch will give me that information there and then.
Fantastic.
So it's great.
Thank you. Over to John. John, I understand one of the skills you have is providing care. Can you tell us how specifically does SafeWatch enhance a carer's job?
Yes. With SafeWatch, the beautiful thing about it is that as a support worker, let's say you're going into a setting, you don't know what to expect. In working with this app, not only do you get an insight of what to expect, but you know the journey of the person over the last week or two. Maybe you haven't seen them. You know where they've been, and you know where they are now. And ultimately, for a person in that situation, they need care, they need support. And you're much more in terms of accountability and just supporting that aspect of the needs that they have. So, in short, it basically allows you to be prepared to go into the environment and have the mindset to address the issues that are at hand currently.
Fantastic. And John, as a carer, what value have you seen when professionals provide activities to patients?
In terms of expert professionals providing activities, the great thing yet again is that it allows the patient to then be open in sharing these activities. And they could share them with one carer or a few carers. And in doing so, it creates a consistency that, in a way, for a carer as well can be seen, and a buddy as well, can be seen as having a valuable accountability. Again, it's basically with any activities that they may have, the person is there and they're able to share that with them, and the patient has that ability then to have that trust and progress in whatever issues that they have.
Fantastic. Thank you, John. Over to you, Adrian. So, Adrian, you and your patients have been using the app for quite some time. Could you share some of your experience and even some of your patients' perceptions of SafeWatch?
Fun to use in session and supporting the sharing of expertise. So I often say to young people, their parents, I'm an expert based on my professional training. They are expert in their lived experience. And if we can do a successful trade, we can share our expertise, we'll make progress. And SafeWatch, it's been a really fascinating journey for me in the way in which SafeWatch has been able to support and enhance that trading of expertise. Young people, I've probably used the app with about 30 families, parents, young people, so less than 18, and young adults. There's not as yet been anyone who's said no. There have been one or two who've said, actually, I better go away, I'm going to have a think about this, do their own research on the issue. They've come back. It looks interesting. What have I got to say about it? So it's supported that shared conversation. It's also helped in a practical way with the development of the care plan, which I would routinely do. And one of my early visions, I suppose, was might the integration of clinical work that I've always done with technology enhance the delivery of care. So in the short term that I've been using it, I mean, the answer is yes. It's been fascinating to have this added dimension in the clinical conversation. Tracking mood. So tracking mood is good for prevention, relapse prevention. Tracking mood is good in this, if someone is struggling in an acute state. They are able to pray. It's very practical and easy to do, should they choose to, and most of them have so far. When we meet, I can have the aggregated data shown to me. That's fantastic. Now, this is all stuff I would have been doing, like pen and paper or other apps over the years. But given my investment and interest in the app and the acceptability of the app to the people I work with, we're trading and we're sharing. So in general, it's been a fantastic addition or enrichment of the clinical conversation.
Fantastic. Adrian, there's over 1,500 wellness apps in the App Store today. You can get an app for a medication tracker, hygiene, whatever. Why SafeWatch?
The vision I've had, and what's been fantastic to work with the whole team, Shane's leadership, the tech team, is the development or the enabling of that vision, which says, yes, there are these 1,500 apps. But what if we had, in a single tool, the ability to track and monitor mood, anxiety, to gather information about sleep, exercise, nutritional, day-to-day functioning, and any individual's unique set of their own day-to-day activities. Now, it won't necessarily be the world leader in each one of those items. But for me as a clinician, having all of them bundled into one tool, that's fantastic.
Fantastic. Thank you so much, Adrian. Sharon, welcome.
Thank you.
Can you give us an example of how you believe SafeWatch enhances patient engagement?
Well, I think that's been discussed very well already, and by all of the team here, but also by Rachel and Darren. That in terms of engagement, but I would say that what's really important is that the patient, when they come to see you, particularly when they've been using SafeWatch, and I've had the experience of this, it's a very valuable tool when they're able to discuss their own experiences and the insights that they've gained through the use of the app in between sessions. It enriches the types of conversations that we have, but the real gift is the awareness raising that goes on with that. And there's so many benefits. I think that you've all discussed that very well.
Fantastic. And Sharon, tell me, how does SafeWatch help to break down the walls of patients seeing multiple professionals simultaneously?
I experience this often, actually, because I work in oncology. I'm working with people diagnosed with cancer, and they're seeing multiple health professionals. And what's often expressed to me is almost a burden of responsibility to adequately be able to communicate with their various health professionals how they're tracking, and they feel very concerned if they can't do that. SafeWatch really is featuring very well in this space now, in terms of supporting their confidence, but also their insights through the use of the app that they can easily access to be able to talk to their health professionals about what's happening. It's an incredibly valuable tool in the oncology space.
Fantastic. Guys, what an amazing panel. How about a round of applause? Thank you so much, guys.